So hi everyone, I'm Dr. Lowthian. I prefer just Emily, feels very formal. I'm going to show you some research today that I've done with myself and my team that are listed below, looking at the educational pathways and educational outcomes for care experienced children using SAIL. I'm just going to quickly kind of flag that this is a Health and Care Research Wales funded study and had enormous support from everybody in this project. I'm just lucky enough to present it today. Just to kind of flag everybody actually on the team, so Professor Tom Quick was the kind of co-PI as part of this project. Dr. Stuart Bedson was again the statistician and the lead for kind of putting all the data together. So we're actually able to do some of the core stats that are shown today. Donald Forrester in Cascade, which Nell has already mentioned, was part of kind of the senior team on this project, shaping kind of how we looked at children in care and understanding kind of the mechanisms behind that. Both Lucy, Ashley and Alex were kind of put in on kind of like the data side of things, access to the data, procurement of the data and the sample. And then John and Gemma in Bristol helped me a lot with kind of the more complex statistics around mediation and mechanisms, which I'll show today. I just wanted to kind of show my thanks to the team because it was definitely a collaborative effort. And I don't want that to kind of be a miss, because there's no way I could have done this on my own because it was much too complicated and hard. Okay, so in terms of educational outcomes for care experienced children, we know that kind of multiple reviews show us that children in care or care experienced children have lower educational attainment compared to children who have no social care intervention. In terms of kind of research in England, which is comparable to today, around 50% of care experienced children reach the expected standard in reading. This compares to 74% who have no intervention at age 7, so quite an early time point. And this kind of compares again to 46% in maths. And what we do also see is this widening. So from age 7, we have that 46% getting expected grades in maths. And then this kind of goes to 40% later on at age 7, at age 11, sorry. And we're starting to see this widening, which kind of sits well with, or kind of aligns with our research presented today. Essentially, by the end of secondary school, that gap widens even further to 17% reaching the expected GCSEs. So 5 A stars, A star to C, including English and Maths or Cymraeg. And that's at age 16 years compared to our 60% in the general population. Now, obviously, these figures do kind of differ, compare year on year and what sample you look at. This sample, the England sample, seems to be a little bit more favourable or higher than what I would usually expect and seen in other research, but I think it's the most comparable that we have to our research in Wales, so that's why I've used those. I did actually go to a conference last week and a care experienced young person told me that I need to use more Welsh statistics because there's too much on England. So I haven't changed those yet, but I will change those. Just to kind of flag that it was an interesting dialogue. Okay. And in terms of kind of the research and evidence on this, what we're really interested in exploring is kind of what contributes towards those protective factors for educational attainment. So what supports them, and then what are the risk factors, what makes them worse, or kind of explain some of that risk over the life course. And it looks like the children who spend kind of longer time in care with more stable placements tend to have higher educational outcomes, according to the research. Those who enter care earlier tend to have higher educational outcomes. And those who attend schools which focus efforts on supporting disadvantaged children also tend to be more likely to reach their potential in educational outcomes. So some really positive research showcasing what we can actually do to support children in care. And then on the flip side, there's kind of key risk factors. So those who have quite unstable, short periods of care tend to be at higher risk for lower educational outcomes. Those who were excluded or suspended also to have lower educational outcomes in general, and then those who have autism spectrum disorder, we call it now autism, tend to have lower educational outcomes as well in combination with their care experience. So there's a few kind of initial aspects of the research which kind of influenced this project and allowed us to think more deeply about what other protective and risk factors may exist. But I think there's a significant evidence gap. So quite a lot of the research will kind of make kind of crude cut points. So what is short-term care versus long-term? We kind of use kind of 2 years, less than 2 years, and then 2 years plus. It's kind of an odd way of summarizing information. I appreciate that a lot of research has only been able to do that so far. but that is an issue. We also don't really know lots about understanding the contribution of multiple placement types. That's something that I really wanted to do in this research. And ideally, we would combine lots of different aspects of duration in care, age of entry, and the length of being in care to actually understand the relationship in full with educational attainment. In addition to that, we wanted to look at what characteristics are associated with different care movements. So boys compared to girls, for example, different ethnic groups where possible, given the kind of small sample that exists for children in care. And then lastly, what I think is potentially the most important and most impactful when it comes to kind of translating this research into practitioners' kind of guidance is what works for different groups of in terms of educational attainment. So, does suspension have a differential impact on adopted children compared to children in long-term foster care? So those are the sorts of things that we started off with. And essentially we had kind of three main objectives. So what we wanted to do firstly was to look at identifying similar groups of care movements in the care system. So we looked at children who have had similar placements, similar timing of age on entry and duration in care. We looked at that in the early years, so from birth to age 6 and 7, and then we looked at the educational attainment. And then we also looked at adolescence, so when they were born all the way up to age 11, and then looked at their Key Stage 2 attainment, which kind of reflects subjective too. So what we did is we timed the time periods they were actually in care, aligning with their Key Stage 1 and Key Stage 2 outcomes. And we adjusted these for kind of key demographic factors, which are quite similar to some of the research that's been shown today. So things like deprivation, learning difficulties, birth characteristics, so birth weight, gestational age, ethnic group, all of those things that are obviously really important when it comes to educational outcomes. And then our last one is we wanted to look at this kind of risk and protective factors for GCSE attainment following care movements. So we used data on individual and school-related aspects, and I'll cover some of those measures shortly as well. Throughout this project, I think we're really fortunate to have so much young people and stakeholder involvement. Before the project started, I was fortunate enough to be able to work with the SAIL consumer panel to get original ideas and feedback on this project, and for the most part it was really favourable, with lots of members of the consumer panel talking about how this would relate to kind of local authorities and practitioners and schools, and kind of positive reflections on what this work would bring. We also worked with Cascade Voices, which was a really important part of this research, deciding what variables we would use for care placements and timing, and kind of how we would disseminate the research, how do we interpret the research from their opinions. So that was really important, and I'll pick up on some of that towards the end. And we also involved kind of charities, government, social care associates, and also teachers from the Happen Network, who all fed on this through an advisory group or separate kind of public patient involvement sessions. So we did have quite a lot of input from multiple different lenses in this research, and I think that's really shaped the research and been a really important part of that. In terms of kind of the juicier parts that maybe this audience are interested in, and I don't kind of cover it too much, sorry, it's not a super technical presentation compared to the others. I'm kind of put to shame in that aspect. But our methodology, essentially we used SAIL data, obviously, that's why I'm here today. But we use the kind of electronic cohort of children, so those who were born between September 2000 and August 2003, and we followed them right up until Key Stage 4, so age 16. We derived lots of their different histories and outcomes, so their social care histories, demographic histories, and kind of secondary school and primary school histories to explore that. And then we linked birth demographic, social care, health and educational records, all to kind of formulate our sample and kind of capture as much data as possible. I just want to flag the boosting technique that was developed by Dr. Alex Lee and Dr. Grace Bailey and was utilised by Dr. Stuart Edson in the study. And without this, I actually don't think research would have been able to be very viable. But essentially the graph shows the green bars are what happens when we use routine ELF linkage. So essentially the ID that's in SAIL, and we link that data. And what happens is when we boost that data by using some really clever kind of algorithms developed by Alex and Grace, that blue chart is that additional sample now that we have available to us by using that boosted data. So you can see that, for the minimum part, we now have roughly around 75% plus linked in the earliest years of 2000s, shown on the x-axis. So The boosting technique has been a really important part of this project. I actually, again, don't think it would have been possible without that. So I just want to flag that work as really important. I think it definitely deserves space on this presentation. Okay. So in terms of the measures, we looked at care experiences, like I said, we looked at placement types, so foster care, kinship care, adoption, other parental care, and all overall. We then looked at the age they first entered care and their duration of care, and we used this essentially in a latent class analysis. So what we do is we say, here are all the variables on our cohort, and tell us if there are any similar groups that have similar experiences, and group them up, and then we can explore their kind of similar care histories, and we can plot them onto educational outcomes, which are shown on the right hand side. So key stage 1, level 2, key stage 1 is level 2, key stage 2 is level 4, sorry, lots of numbers, and key stage 4 is 5A star to C, including language and mathematics. Obviously language includes both English and Khmer. We also then, like I said, adjusted it for demographics, so sex, ethnic group, deprivation, learning difficulties, birth characteristics, and mother's age at birth. That's a summary of most of those demographic characteristics. And then in terms of the mechanisms, what we were interested in, that kind of risk and protective factors. So what can explain the link between the care experience groups and educational outcomes? We looked at school moves, attendance, SEN, special educational needs. We used the word SEN, not ALN, because this research was done at the time where SEN was the kind of SEN system rather than the new ALN system. Preschool meal, mental health outcomes, so diagnoses, symptoms and treatment, and then suspensions and or exclusions. Largely were suspensions. There were not too many exclusions for us to include in this research. So in terms of the results, which is, the exciting part, what I've done is kind of summarize this through our report, just because I think this looks a lot nicer to kind of absorb, because there's a lot of stuff going on in this project. But essentially, when we ran this latent class analysis, basically looking at summarized versions of children's care histories, we found 7 groups in the early years, so those between birth to age 6/7. And we found that 3% of them were adopted, and we show that on the kind of, I suppose, the exaggerated pie graph on the left, and then we have our bar chart on the right showing the educational outcomes of different groups. So we had to kind of mask this outcome of adoption. 100% of adopted children reach key stage 1 outcomes, and that's just because it was quite a small group. So but essentially adopted children met the national kind of non-intervention group standard of around reaching key stage 1. We also found 8% of our sample were primarily in kinship care, and 66% of them met the expected levels for key stage 1. And then we also have our group who return home, which I think is really interesting. So these children, 17% children, 17% of them, kind of enter care quite early, around like 1-2 years of age. They spend a short period in care, and then they return back home with their parents, and they don't re-enter care from our knowledge over that time, given it's such a short period in duration. We can judge roughly that they don't, they may re-enter and come back out and re-enter again, but to our knowledge, it did cease to returning home, and we have quite a short duration. So there's that group, which I think is really interesting and kind of comes out in this research more than other research that we've seen so far. And then we also kind of have this this group, like multiple groups. So we've got our foster care group, post and preschool mixed placements. If I focus on the foster care group, we essentially have 21% who enter foster care post going into school, and then 14% who enter foster care pre going to school. What's quite important in terms of this group is that for those who enter foster care just after going into school, their educational outcomes are 63%, whereas those who enter foster care just before going to school, their educational outcomes at key stage 1 is around 40%. So there are big differences here, and timing seems to really matter when it comes to foster care placement. And then we've also got our kind of mixed placement group. So those who had kind of kinship care, parental care, foster care, and some of them, a small percentage, did also return home to their parents. These are quite mixed groups. Again, we find differences in their age of placement. So 19% go enter care early, less than 1 year of age, and then 17% enter around toddlers. And you can see they have quite similar outcomes. So 58-65% reach key stage 1 outcomes. And what we do see, apart from the foster care group that entered care just before entering school, we do see quite similar outcomes for early years, apart from that one group. So something quite stark to absorb there. But that does unfortunately change as we kind of evaluate our age 11 outcomes, the key stage 2, the end of primary school. Firstly, we start to see adopted children drop now to 60% are reaching key stage 2 outcomes, which is kind of in line with some of the literature. I went to a Welsh Government conference last week, and someone from an adoption charity was talking about how this is observed a lot in different research. We also find, again, that our kinship care group that we see again in this research, so following children's movements down the care system from birth to age 11, kinship care young people are only 45% are reaching key stage 2. Again, the non-social care interventional general population is around 80%. So we're now starting to see quite a significant gap appearing in educational outcomes. We also now have a separate foster care group in this analysis rather than separated by age. 43% are meeting key stage 2 outcomes. And then we kind of have, again, these mixed groups. So in the last analysis, we had this return home, we had that early entry, and that's still there. So people who come into care for a short period of time, return home to their parents, and then carry on and don't re-enter the system over that time. They come in around age 1/2. What we also had, 23%, is a group of children who come in quite late to care, so around age 8, and then they return home to their parents. And what we do see is this quite large difference around the timing of coming into care and being reunited with family. So for early entry young people, 52% met key stage 2 outcomes, but for late entry young people, only 36% of them, which is our lowest group of all, met key stage 2 outcomes. So timing is really important here, we think. And then we've also got our mixed placement group, exactly as last time, with our kind of early age 1 group, again observed in the last analysis. And then we have our preschool mixed placement group as well, so around age 3. And they do obtain quite similar key stage 2 outcomes of 42 to 48%. But there's clear that there's quite a large drop-off now as we go later on into kind of moving from childhood towards adolescence. We are seeing that drop-off. And just to kind of cover the other aspects of this, like I said, we did adjust for demographic characteristics. So girls had 11 to 15% increased odds of attainment. Low birth weight reduced the odds of key stage 1 by 17%. Children in foster care were less likely to be born into affluence. So that we're looking at kind of birth deprivation. We found that adopted children are more likely to be born affluent, which was quite interesting. And then we have our kind of Black, Asian, mixed and other ethnic groups had 21% increased odds of key stage 2. Unfortunately, we did have to put all other ethnic minority groups and marginalised ethnic groups in kind of one category together. And that's just because we have the sample size of this is already 1,140. And we do have quite low numbers of marginalised ethnic groups. So we weren't able to kind of look at that in any more depth. So that kind of covers some more characteristic side of things. There is a lot more going on than that, but I wanted to summarise kind of the key messages there just for the sake of presentation. And then the final part of our research was looking at this risk and protective factors for GCSE outcomes. So like I said, we explore their care placements up until age 10, 11, the key stage 2 analysis I've just shown you. Then we look at the risk and protective factors as a mechanism in secondary school. So what could make things worse, what could make things better? And then we look at GCSE outcomes at age 16. So essentially, this is a causal mediation analysis exploring what mechanisms exist for explaining different care groups' relationship with GCSE outcomes. That's a very summarised version. It took me a lot longer than what I just said. It was very painful. So in terms of the analysis, 14% met GCSE expectations compared to 45% with no social care intervention. So this quite significant gap that aligns with other research and is really concerning, I think. So in terms of kind of prevalence of these aspects, 75% of the sample had SEN-ALN, 5% had mental health problems. So kind of like the first presenter, Jean, on mental health problems, we had quite a lot of under-identification in this area, but that's largely because we were looking at teenage kind of prevalence. So something to bear in mind there. 1 in 2 had free school meals, 35% of them had experienced suspension or exclusion from school, and 93% was the average attendance over the secondary school period, which is pretty good. And there's been complications with comparing that to now because of COVID-19 and how attendance has dropped off significantly, but 93% is not kind of out with the ordinary, so that was quite positive. However, the rest of the outcomes in terms of SEN and free school meals and suspension and exclusion were significantly overrepresented in the sample compared to the general population. So if we look at findings for what works, so how can we explore the relationship between different children's care histories and educational attainment at age 16, we found that school moves were a specific risk factor for those children, so the group of children who returned home after a short period in care. So moving school can explain the reduced GCSE outcomes for that specific group of children. And if we look at kind of simple regression paths, moves were associated with a 46% decrease in odds of attainment, so quite a significant risk factor. In addition, we see the same thing for free school meals for the same group. The children who enter care early get placed back with their parents. The free school meals in secondary school periods, so essentially household deprivation, were related to lower GCSE outcomes. And then again for suspension and exclusion, again for this group of children who enter care early and then return back to their parents, suspension and exclusion was particularly important for that group, with 70% reduction in odds in attainment where suspension and exclusion exist. In terms of the other aspects, we didn't find any kind of mechanism or mediation happening with special educational needs, most likely because quite a large proportion of the group had special educational needs. And because the sample is quite small, we haven't really been able to break this down any further, which is kind of frustrating because I think a lot of people and practitioners in particular would be quite interested in specific aspects of this. But that's just kind of where we are in the research at the moment. We do see, however, an 87% decrease in odds of attainment if ever identified at one point, and that's very similar to general population outcomes that I've just investigated as well. And we don't find any association. We couldn't run the analysis for mental health and school attendance just because the model wouldn't converge. I've tried lots of different ways of doing that, but we just couldn't get that working in the end, which is unfortunate. So I'm a little bit conscious of time, so I don't want to overrun. But essentially, kind of this slide summarises what we found already. So adopted children are reaching the national expectations. Children placed with relatives had higher educational attainment, so it could be social support buffering, but we need more research on this. And those who entered foster care just before school had the lowest attainment. So things to consider there. Again, a slide just covering that and summarising that for pre-adolescents. Adopted children again had the higher educational attainment at Key Stage 2, but 20 percentage points lower on average than Key Stage 1. We find that timing really matters when it comes to educational outcomes, and mixed placements in kinship care groups had very similar attainment. And this is quite similar to wider research, which discusses how foster care and kinship care seem quite different early on in life, but as children's life kind of progress onwards, we start to see that kind of drop off for kinship care and that more kind of similar outcomes for different groups. So it's reassuring to know that our research matches some of the stuff that's already out there. And I won't cover that too much because I think I've covered that in the last slide. So just want to kind of cover some reflections briefly around the small sample of these types of analyses. They're not causal. I know we use population data and causal mediation analysis, but the causal mediation analysis couldn't use every single demographic aspect possible. We could only use quite a limited set. And we don't adjust for prior experiences, which we think is obviously a really important aspect of kind of ACEs and for kind of some of which Nell talked about. So we don't adjust for those things. We also want to note through our kind of Cascade Voices research, this research can be considered as stigmatizing. It adds to that deficit perspective that children in care are doing poorer than kind of children who've had no intervention. And that's why this research has kind of been now pivoted towards practitioners and developing guidance and animations for practitioners and teachers to make sure that this work actually gets used in a positive way, rather than sitting on a shelf and kind of adding to that kind of stigmatizing literature kind of base, which covers it there. There's just some conclusions. So we want to challenge the notion that educational attainment can be derived from individual aspects from care. Our research shows that multiple aspects of care relate to educational attainment, and children who return to their birth parents after short-term care stays are at higher risk of poorer school experiences, and later entry and unification is related to lower attainment too. So things around this hidden group of children where they come in briefly and go back out there's a lot more work to be done there to understand that. But this research kind of is one of the first that highlights that. And we do also need to do more research, including pre-care experiences and complex histories. Okay. In terms of where next, I need to publish a second paper. One of them has got revisions that I also need to do, building a network of people who are interested in this work in this area. So if you are interested, please do get in touch with my email at the bottom, as I'm planning to do a little bit more work with this already. So diolch o galon, thank you very much.